Hi, my name is Dr. J. Sordean, and I practice at the Redwood Clinic. In all matters related to wellness, I urge you to take the natural path to optimal health. Not only for active health issues, but even better for prevention of illnesses that may occur in the future if you don't take care of them now. I'm a licensed acupuncturist, a certified traditional naturopath, and a QME. I've been in practice for more than 30 years. My purpose is to help as many people as possible achieve maximal health and vitality so that they can fulfill their goals and purposes in life. I've seen thousands and thousands of patients over the years, and we also do company wellness programs. It includes on-site injury risk, lectures on safety and ergonomics, individual confidential health screenings, and giving aggregate report of findings to the company to help decide on future lectures. Our target audience is companies or organizations of 50 to 200 employees that want to improve their productivity. In general, more than 80% of disease and illness can be traced to 5 contributing factors. They are traumas causing blockage of cerebral spinal fluid, oxygen and blood flow, toxic load in the body, being overweight, having huge stress responses, and inflammation. How many of you primarily use your muscles for the jobs that you're in? Or rather, how many of you use your brains much more than your brawn? Well, I would think that if you're using your brain, you really have to think about how much is your brain worth to you. After all, it is your livelihood. Many people would say it is quite invaluable, so they would do anything they would do to help keep it healthy. What would your life be like if you started losing your brain functions, however? Well, a patient of mine who's in his mid-60s came in with tremors, shaking arm and leg, memory issues, movements delayed, neck and shoulder immobility. It was set off by surgery and chemotherapy 2 years prior. He can't do 80% of his job. He has a long history of various assaults, heavy metal toxicity when he was young, playing with mercury and having amalgams in his mouth. Mercury is very toxic. He also worked for 4 years in an aluminum smelting plant, and aluminum can cause neurotoxicity. He was exposed to lead while working in battery factories for many years. Lead damages the nervous system and causes brain disorders. It can also cause blood disorders in mammals. He works on heavy equipment and all, and they use carbon tetrachloride to clean various parts as well as asbestos in brake shoes. Then again, he also had the cancer chemotherapy, which in and of itself is a poison. With respect to traumas, he was hit by a car at age 6, and he had a bad fall from a tree, breaking an arm at age 8. Now, you might think, this just cannot happen to me because I live in Berkeley. However, we're all exposed to the same environmental toxins, and now there are more than 100,000 chemicals in the environment. Only 10 to 15% have ever been tested for medical damage. You may remember thalidomide of the 60s. People often tell me, I wish now that I'd taken those things more seriously back then before they turned into what they are now. So there are physical problems that can also cause these issues. Muscle tightness, vasoconstriction, meningeal compression due to stress responses and trauma. These things stop the flow of oxygen, blood to the vital organs. I have training and 30 years of experience in locating up to 2,000 different acupuncture points in the body in order to find the areas where this is blocked and to correct it. Many people come to me for a variety of reasons. One is to avoid surgery as long as possible.
I've been having some problems with my knees, low arthritis, so I just wanted something to help relieve the pain without having to take a lot of medication. But some people can't take a lot of drugs, you know, they have allergic reactions and that kind of thing. And if you just don't want to put all that stuff in your body, I would recommend this.
So many people also do come to avoid drugs and other medications which do not agree with their system well. It's important to take into consideration that your brain is something you have to take care of. You don't get another one. And so time waits for no one. An example of this is a new patient of mine who has multiple sclerosis.
They're blurry. My eyesight gets blurry. and or I'll start to drag my legs, my muscles.
Both legs?
Well, no, mainly it's my left leg that I do tend to drag a lot. My right leg's pretty strong.
And then your left leg, what other symptoms do you get?
Numbness. I get numbness in my thigh and in my calf on the side of it.
And how often is that?
Not too often. It's rare. Actually, it's generally in like the summertime or in the heat. When I'm in hot environments, I'll feel it.
And so you're also taking medication.
I'm taking medicine.
That's been for how long?
Going on 7 years.
7 years. Okay. Do you mind saying what your condition is?
I'm taking Avonex for multiple sclerosis. So I get an injection once a week.
And you get some symptoms from that too.
And I still get, yeah, well, the symptoms that I get for taking the medicine is flu-like symptoms. And I usually get those for 24 hours. It lasts.
So you do something to mitigate that?
I take Tylenol, extra strength, and which will pretty much knock me out. So I don't have to go through the pain and the worry of the medicine.
All right, this is after the test. And we did a testing for about 5 minutes. So tell me what you noticed as far as your back goes.
After 5 minutes, my back is, the pain's not there anymore. Like previously I rated it a 4 to 5, and I would say I wouldn't even, if I had to give it a number, I'd give it a 1, but that wouldn't even be right.
Wow.
I don't feel it anymore. It's weird.
So that's a big change.
It's a huge change.
Huge change. And what happened now?
So before the test, I noticed that I was dragging my legs and I was walking slower. But now, after the test, when I walked again, I noticed that I was walking faster and I was actually more upbeat, and I wasn't dragging my legs anymore. I was picking them up instead. With each step, it was being picked up.
And you felt lighter or something?
I felt lighter. I did feel a lot lighter, and I felt more upbeat. Like I wasn't, because previously I felt like I was slumping, but like right now, walking back, I was more, chest back and walking straighter.
A very key question is, how many of you can afford to let your thinking degenerate? Do you think you might suffer like she does, or like the other man does? How would that create difficulties in your life, or for that of your family? So don't you think you should take some action now to help prevent this? I consider this to be a real no-brainer. The most common cause of bankruptcies in the U.S. is due to medical bills that cannot be paid. More than 80% of medical costs go to chronic illness and end-stage medical and hospital care. You want to avoid these issues by being as healthy as possible. Procrastination is like a credit card. It's a lot of fun until you get the bill. You can use acupuncture to improve the flow of blood to your brain now, but if you were able to get a brain transplant, which of these brains would you choose to have? One of these, or two of these? There's not really that choice, but you can see the point I'm making. A famous president stated, "'Tis better to be silent and be thought a fool than to speak and remove all doubt." So with these wise words, I leave you with the thought that I encourage you once again, take the natural path to optimal health to prevent degeneration of your brain and body so that you can live a full and healthy life.